Sorry, Jess, I was just watching the rerun of The Wolf of Wall Street, and that's how they get excited about what they're going to go and do. So I was doing it for Alpha 2.0.
I thought you were having a heart attack.
All right, what are we doing today?
It's the June 24th episode of Health in 2.0. Okay, so I don't know what that was, but truly I thought you were trying to restart your heart. And I was like, oh my God, get your defibrillators ready, people.
It's Leo DiCaprio and Matthew McConaughey, Wolf of Wall Street, like going, trying to get themselves ready for the day of going out and pimping penny stocks to the massively high levels, a bit like, Teledoc and Livongo at the moment. Well, they seem to be going up without Matthew McConaughey helping.
The only fun we're going to have this year, because that's it, officially conference season called to the quits here. Health has gone virtual. Rock Health is virtual. Oh my God, somebody better have invested into like a mental health app to help me along here because...
I don't know. Perhaps we should see. Let's go then.
Wait, what did you think real quick about those digital events? You want to get into that?
I just say they suck, but that's what they do.
Yeah. Okay, let's get your timer. I have a bunch of funding deals.
Okay, let's go on the funding.
Hey, just in case, just in time for your heart attack, DispatchHealth gets 136 million. Optum is in this, Oak, a bunch of people.
Yeah, Echo's in this as well. This is another send someone to your house like Heal and like, is it Ready? It was Ready, the other guys we talked about last week, who got 35 million from Google Ventures and a bunch of others. And Dispatch was in Denver, and now it's in a bunch of places. It used to send a tech. I don't think they send doctors. I think just Heal sends doctors. Heal also has telemedicine and also does stuff for like Medicare Advantage plans to keep you out of the hospital. It's a big sea change as we're getting more into the stuff that I call the continuous clinic. Come back for more later.
Oh, all right. BrightInsight gets 40 million. We can't figure out what they do.
Now, I kind of figured it out. They've got deals with AstraZeneca and some others and Roche, and I think it's Roche, and it's a way of managing all the different devices that can measure at-home clinical trials. It's a market that's been coming for about 20 years. Maybe it'll finally happen.
All right, Cedar closes a massive round, 102 million. It's a medical billing startup, but part of this is debt. Explain this whole thing to me.
Oh, God, I mean, debt versus equity, whatever. I mean, who cares about the structure of it? This is similar to Simply, which sold for like 120 million last year, having been around for a while, helping basically provide organizations figure out how to get consumers to actually pay up for their below deductible stuff. It's part of our healthcare sucking, and it's people taking advantage of the fact that healthcare sucks. Not a huge fan, but, I guess if you're going to raise money, if you're going to collect money, you can raise money to collect money.
Big Health gets 39 million. They're best known for Sleepio and Daybreak.
Daylight. Daylight is the new one, which is CBT for people with anxiety and depression in the day. Sleepio cures your insomnia at night. British company that's well with the NHS. Been getting there or thereabouts in the US. Hopefully this will boost them up. This is quite a big round for them. The previous round was like 10 or 12, 15, I think, a few years back.
All right, Redox lays off a quarter of their staff. Sad news there.
Yeah, apparently hospitals aren't doing anything, and they sell to hospitals, and
there you go. What about Plume? This is an interesting one. This is a healthcare services startup for transgendered people.
Yeah,
interesting. Million. General Catalyst is in on that round. It's seed
General
money.
Catalyst is in something as low as 2.9 billion. That's 2.9 trillion.
Maybe they cashed in their Livongo stock, had a little bit extra, and decided to throw it here.
I think General Catalyst tends to like slightly bigger checks than that usually, but this is interesting, right? This is how sort of unbundled health places. There is a clinic that that Catalyst at Health 2.0 now worked with for years called Callum Lord, which is a clinic aimed for LGBTQ people in New York City. And they worked with Rubicon MD to do consults and stuff, and it was a very successful partnership. So there was some sort of telemedicine part going into that world, but obviously that's a big concentration of folks, with transgender issues. But I think that the issue with transgenders, there aren't that many people in any one place, right, who want to go through sex reassignment surgery or whatever the hell it is. So they're going to bundle that stuff together, do it online, and hopefully manage you. So this is kind of like Verta doing diabetes, but it's a small niche market. Pretty interesting is you've got to imagine those people have pretty bad experience with the usual healthcare system. And just this week, HHS rolled back, in a punitive measure, basically rolled back the ability of doctors to discriminate against people who are transgender. So hopefully this is it's a good deal. I mean, we'll see how it goes. Interesting small company, but something that's, I think very necessary for a very small but certainly under-resourced and privileged population.
Yes, I like that. And it's Pride Month. Yay.
And it's Pride Month. Yes, good point. June it is.
I'm just trying to, line these things up here.
Well, we're out of our 2 minutes, and we're not going to any conferences ever again.
No, I know. I'm really bummed.
I mean, so you were telling me, ATA is going on right now. I don't know how it's going. You were telling me that AHIP did some interesting stuff with their virtual conference.
Yeah, I had a quick chat with my friends at Teledoc, and they were saying that they really enjoyed AHIP's conference. They thought it was really cool. It was kind of like the way it was described to me was like The Sims. Like it was like there were lots of things to go visit, and it was kind of a really cool virtual experience.
I played the Sims game in 1993 for about 4 days. And
I do not see you having the patience for that.
I mean, I think we were at the behavioral health thing, which was our speech was brilliant. It was kind of fun doing a pre-recorded talk and then like chatting with people up and down. That was a good amount of response. And the other thing that worked well is Umbrella, which is that little Finnish company that was bugging me for years about coming to Health 2.0 and now sets up the matchmaking meetings, similar way that HLTH has been doing it. But really matchmaking and presentations and exhibit halls and drinking at the bar or, around are all different things, and they're all bundled together in a thing called a conference. It strikes me that we don't know what the next thing is, and most of us who like the drinking in the bar part the most want it all to get back bundled up together so we can go back and get to what we know. It's going to be different, but things are slowly starting off. Restaurants are opening up. God, the Premier League soccer's back on with faked crowd noise, which is weird as hell. Somebody's got a button to push for the cheer when there's a goal.
We should get that for this show.
We should have fake crowd noise. Yes.
Amazing.
All right. I think now we're talking about fake
Oscar music, so I can play you off when I'm done talking to you. Thank you.
The Oscar, yes. Some point, like going on about the Premier League, and you can
just play the song, and that's it. There you go. Oh, that's it. Thank you.
All right, you better get us out of here.
Yeah, okay, I'll get us out. All right. So to follow along with Mr. Holt and hear more about the fake crowd noise in the Premier League soccer, follow him on Twitter at BultyBoy. I am at Jess Damasa. And of course, you can go to thehealthcareblog.com and sign up to receive our email newsletters so you never miss a Health in 2.0 episode. And you also get curated content from the blog sent to your inbox every week. Mr. Holt, see you soon, my friend.
Bye, Mr. Massa.
Take care, guys.